My name is Steve Salzbrenner. I went to medical school at Creighton Medical School, and I did a residency in the Navy at San Diego and then at Virginia as well, so a little bit in both places. And then I served for 8 years. I was in various different locations, and I served in Operation Iraqi Freedom over near Baghdad, where I managed a combat stress clinic. And after I got out of the Navy, I came back to Omaha, did some inpatient work for 5 years in psychiatry and 2 years of private practice, and kind of had a desire to get back into the academic world. My heart just led me to medicine, and psychiatry, it just resonated. It was the only thing that really deeply resonated with me. I just love to get into people's minds and learn about how they function on a deeper level, what motivates people. I can't imagine doing anything different because I really enjoy getting past what you can observe with your senses and really kind of meeting people where they're at on kind of a deeper level, where you can help them to cope or heal from struggles that are hard to explain, or that are often not measurable by labs and scans and microscopes, but cause just as much or more suffering. So I really enjoy being able to help people in that way. I like academic medicine because it keeps me accountable. If I have to teach or answer questions from medical students or residents, then I have to know what I'm talking about. So it's just hard to fool a medical student or a resident, because they have the textbooks, and when they leave, they can go look it up. And so I love to have that accountability, so that I am always on the cutting edge of what's going on. And then I also like to share my experience over the many years that I've practiced, so that I can sort of guide the students and the future providers in the intangible ways, the stuff that you learn that isn't really in the books. When I'm evaluating a patient, I don't necessarily see it as a doctor and a patient. I see it as two people getting to know each other, so that I can use my knowledge to identify areas where they might be struggling, areas I can help. And then the doctor part sort of starts to seep in as I ask more and more questions. But really, it just starts off as just two people getting to know one another.